Hi, so we're here today with consultant paediatric oncologist Professor Simon Bailey, whose speciality is neuro-oncology. So first, I'd just like to thank you so much for giving up your time to speak to us today. It's so generous of you, and it's great to have you here.
Thanks, Vicky.
So my first question for you is, would you sort of be able to talk to us a bit about how you came to be in your job today and a bit about previous oncology jobs you've had?
Yeah, I can explain a little bit about my career, which probably isn't as straightforward perhaps as other people. So I was born in Britain but grew up in South Africa, went to medical school in Cape Town, and then came over here after my house jobs to the UK and specialized firstly in pediatrics at a number of hospitals, then went to New Zealand for a year to work, and then came back to Newcastle having decided I wanted to do pediatric oncology. Pediatrics obviously my first love, and pediatric oncology. So I came up to Newcastle, did a year or so of pediatric oncology, then did a PhD in the laboratory, and then came out, finalized my training, and then was lucky enough to get a job in Newcastle, and I am still here today. So that's a pretty potted summary of the oncology jobs I haven't done. Yeah, I've done pediatrics and oncology essentially.
Brilliant. And how long have you worked at Newcastle now?
So I came originally in 1994, so I'm not going to do the maths because it's too bad.
That sounds like a long time. And what kind of inspired you to take up pediatric oncology? Is there anything you particularly enjoy?
Yeah, so I think the children is the most important thing, and the families that we see, that's it's a privilege, and we get to know them and follow them up for quite a long time. So that's definitely a benefit. There's a lot of science involved. There's a lot of very interesting mechanistic things that we learn about. But I think most importantly, I think you can make a difference to families and to children. And it's the combination, I guess, of all those things that made me want to do oncology. I had a little taste of it in New Zealand, and that's why I applied for oncology jobs when I came back to the UK.
Brilliant. And yeah, it definitely does sound super rewarding being able to make such a difference to so many young people's lives. But obviously when we think of oncology, it can often be quite a scary topic, and especially with children. I can imagine it can be quite challenging sometimes.
Yeah, it can get it can be very emotional, because not all children sadly are cured. The diagnosis is devastating for the families. I mean, the children are amazing, and the young people, the teenagers who, the fortitude and dignity with which they fight these diseases. But yes, there are uncomfortable conversations when things aren't going so well. And I think you just have to also learn how to deal with that in your own way. But we've got to keep in mind that not everybody, unfortunately, can be cured. It's not necessarily anybody's fault. But I think their journey through the disease also is really important, and we've got to make sure that they get that journey, and we make it as good as we possibly can, even if the outcomes are not always as we'd want. In saying that, we do cure about 70% of children with cancer, so I think that is more common than not, and seeing them grow up and blossom through the years is extremely rewarding.
Yeah. And so one of the things that attracted me to sort of maybe the idea of oncology is how much research there is that you can undertake while having a job in oncology. Would you be able to tell me a bit about maybe some of the research that you're doing at the moment?
Yeah, so I think research is a very broad thing, and there's, oncology you can choose. You can become a pure academic with only very little clinical, or you can do half and half clinical and research, or you can be a clinician who does clinically based research. So I think you need to do things that suit you, and I'm lucky enough to be involved in all the different aspects I did a PhD, so I have some background in laboratory experience, and I'm going to say mainly collaborate in a lab, but supervise students without actually doing any of the laboratory-based research. Personally, myself at the moment, I also run clinical trials, and I think probably at the moment the biggest one is the European trial which I head for high-risk medulloblastoma, which is a type of brain tumor, and you get to meet some amazing people from around the world and in Europe, and together it's very much a team thing. We try and improve the lot of children by reducing side effects and increasing cure rates for disease. So I think it's a very rewarding thing, research. I think each person needs to do whichever research suits them the most, and you can do a combination of things as well.
Brilliant. Sounds like there's so much available for oncologists to do. What would you say to someone who is considering sort of oncology or pediatric oncology as a career?
So I think you really need to want to do it. I think you need to have a passion for it. There'll be a lot of upsides, but also some downsides. And it's not everybody's cup of tea, I'm going to say. But I think if you're passionate about it and you want to do it, you'll be very rewarded by doing it. But I don't think anybody should be forced into doing it. I think it's something that you need to as you did, you've been as a student and come to oncology clinics. And I think people need to be, keen to do it. Don't do something because you think you ought to. Do something because you really want to. And I think when you're getting into your 50s and you still want to get out of bed and come to work, then you've made a good choice. I think that's for any career really, but oncology is exactly the same. And I wouldn't swap it. I'd go back and start again tomorrow, but perhaps I'm one of the lucky ones.
And what do your days kind of look like at the moment in the department?
They vary. There's clinics, there are meetings, lots of meetings. As head of department, I have a number of those sort of meetings to go to. There's international trial meetings, there's research meetings, there is various things, a lot of patient meetings, trying to get the best for our patients. That takes priority over the other sorts of things, but each day is different, and our diaries look very full because we're doing lots of things. But it's if we didn't want to do it, I guess you don't have to. You make a choice, and you need to enjoy it.
And I've noticed you've got a suitably excellent tie on today. Do you find that sometimes, I know that some patients have given you things in the past, what's maybe one of the favorite things you've ever been given?
Oh, I think there's lots of things I've been given, and I think the favorite things are when the children make things themselves. So I've got a number of things that children have done. This is a tie from Chemo Duck, who's, as you know, Chemo Duck is the duck that all the children get, who has a central line, and that they can kind of do some play therapy through to try and make it more tolerable. But I think it's the things that children make for you themselves and give you. Those are the really precious things.
And I know that you do quite a lot of charity work as well. Would you be able to talk to us a little bit about your work in Malawi?
Yeah, so there's two charities I'm involved in. One is Children with Cancer in Malawi, which Rod Skinner and I set up in 2005. Malawi is a very poor country, but with some amazing people, and so we support them both academically, but also financially, paying for nurses and various equipment and things like blood counters. And we look at their pathology remotely because they haven't really got a pathologist who can do it in a timely fashion. And so we spend quite a bit of time doing that, but that's extremely rewarding. The children all over the world with cancer are exactly the same. They just don't have the same resources. And so that's that is amazing. And the other charity I'm involved in is something called Dream Flight, where we take 192 children to Florida each year, people with illnesses without their parents, but with doctors, nurses, and physios, and we see the theme park. So it's a lot of work that goes into that. And in fact, that's where I met my wife. So it's extra special. She was a physio. She is a physio.
Wow. And so do you get to go to Florida every year?
I have chosen only to go every second year because it's a bit too much to go every year.
Yeah.
But I'm a trustee, so I am involved in the day-to-day as well.
That sounds amazing. I don't think I'd ever get sick of going to the theme parks.
No, that is true. You're obviously a pediatrician in waiting then.
And just to sort of sum up, how would you describe pediatric oncology in sort of 3 words?
A great privilege is probably the 3 words. It's a privilege that people, young children and their families, trust their children with you, giving them quite potentially very powerful treatment, and they open up their lives to you, and I think that's a huge privilege, and we should never forget it's a great privilege to actually serve them in that way.
Yeah. And do you have any top tips for people looking to get into pediatrics or into oncology?
I think the top tips are, you must decide what you want to do by looking around and seeing, and if the passion is there, then I would look at ways to doing it, and usually talking to your local oncologist or pediatric oncologist is a good starting point. We look for people obviously that are keen and have in a fire, so to speak, and then you need to enjoy the journey as well. Don't rush to think, oh, I've got to be a consultant, because actually that comes with its own issues. So you need to enjoy every step of the way, all the way from being a medical student all the way to to being a consultant. All of the bits of the journey are amazing, and you need to really enjoy it and have fun along the way as well. Don't you need to go and do things as well and enjoy yourself.
I don't think you can be a pediatrician without having fun. I don't think the children would let you. So
it's certainly a good excuse to watch children's programs and play with their toys.
Brilliant. Well, thank you so much for coming to speak to us today. It's been really insightful to learn a bit about your life and your career, and hopefully it's useful for any medical students or anyone interested in paediatric oncology out there. So thank you very much.
Thank you, Vicky.